This presentation on the Collaborative Action Plan for Accessible, Appropriate, and Equitable Grief and Bereavement Support in British Columbia, an evidence-informed approach, will discuss an overview of what is part of the Action Plan report that was developed by the BC Centre for Palliative Care. Before we begin, I would like to go over these definitions. Grief specifically includes a wide variety of responses to loss, including losses other than through death. For example, anticipatory grief, which is grief that occurs prior to the death. Bereaved means to be suffering from being deprived of someone you care about because of their death, whereas bereavement is defined as the period of time following a death during which a person experiences grief and mourning. Well, these pictures show a life not too long ago. Over the first couple of years of the pandemic, COVID-19 affected every aspect of life and death. Through our conversations with our partners in the community and health system, we found that many of the restrictions and changes during the pandemic have made it tougher for those grieving the death of someone significant. We also realized that the impact on the bereaved has received limited attention from the health system. In May 2021, the BC Centre for Palliative Care kicked off a bereavement initiative with a steering committee comprised of 6 members, 2 public partners who had lived experience with bereavement, and 4 representatives from leading organizations that offer bereavement support services and resources. We designed the initiative to find answers to 5 key questions: how people in BC have experienced bereavement during the pandemic, how and where they access bereavement support, how bereavement support has changed through the pandemic, what forms of support were effective during the pandemic, and lastly, what could be done better going forward. During the initiative's first phase, we conducted comprehensive and in-depth research to better understand the current landscape of bereavement experience and the available support in British Columbia. We then hosted 2 symposiums, one with the public and one with bereavement support providers. The aim was to validate the research findings and fill in any gaps in our research. The validated research findings were used to guide a provincial roundtable discussion with experts and leaders in the bereavement sector in fall of 2022. The purpose of this discussion was to pinpoint actionable strategies aimed at strengthening the coping mechanisms of those who are grieving and enhancing access to effective bereavement support services. You can find more information on these studies and findings in our full action plan report. The Provincial Bereavement Roundtable consists of 35 participants, including 32 different organizations with 2 public partners. The roundtable participants came from a wide group including grief and bereavement support providers, researchers, community leaders, policy design makers, and people who had an experience of bereavement. In the roundtable, they identified important actions that they wanted to see implemented to enhance grief and bereavement support in British Columbia. A few days after the roundtable event, a follow-up survey was sent to the participants to identify the most important actions for implementation in the next 3 years. A total of 29 people from the roundtable completed the survey, which was an 83% response rate. The action plan developed contained an overview of the ideas proposed by the participants in the roundtable. The 27 action items were grouped into 3 pillars or themes: accessible, appropriate, and equitable grief and bereavement supports. The action items under each are ranked in order of most important actions for implementation in the next 3 years. For each of the 5 categories, the ranking of the priority actions was determined by using a weighted calculation. For example, if a category had 5 action items to choose from, the most important ranked action would be assigned 5 points. The second ranked item would be assigned 4 points, etc. The lowest ranked item would be assigned 1 point. The overall highest number of points would determine the overall ranking of the action item in the category. In case of a tie, the one with the most top rankings will be ranked higher. Pillar 1, Accessible Grief and Bereavement Supports, with 2 subthemes that focus on improving awareness and availability of grief and bereavement supports. The vision: British Columbians are aware of existing services, able to find the resources they need, able to access the right supports for them at the right time and through the service delivery mechanism of their choice. Roundtable members propose the following 11 actions. 5 action items under awareness of supports, with number 1 being ranked most important by the Roundtable members. Number 1, develop a roadmap for bereaved people on what to do after a death. After someone dies, bereaved people become responsible for organizing death rituals, clothing estates, distributing property, and more. Most individuals are unaware of the steps that need to be taken and the forms that need to be filled out after a death has occurred, really leaving them to navigate complex systems while they are grieving. A roadmap tool should be developed that illustrates the steps that must be taken after death has occurred. Rank number 2, engage in proactive outreach to connect bereaved people to the grief and bereavement supports they need before death occurs. Number 3, establish a central navigation tool for bereaved people to better identify available resources. Ranked 4th, create a resource hub for grief and bereavement support providers to find information, tools, and other resources on evidence-informed grief and bereavement services. And 5, establish regional navigators for grief and bereavement services that act as living resources for accessing supports in their communities. There are 6 items under awareness of supports. Ranked number 1, enhance the availability of free or affordable, flexible grief and bereavement support options for bereaved people, including 24/7 access to a toll-free helpline, in-person support, virtual support, one-on-one support, group peer support, and more. Rank 2nd, advocate for funded grief and bereavement supports as a universal benefit under Medicare. 3rd, strengthen access to grief and bereavement support providers in long-term care homes and hospitals. Ranked 4th, advocate for enhanced bereavement leave benefit for employees. Number 5, promote the establishment of the provincial government ministry for the bereaved. And 6, draft a Bill of Rights for bereaved people to outline their basic entitlements during their grieving period. Pillar 2, appropriate grief and bereavement supports, with 2 sub-themes that focus on improving grief and bereavement literacy across society and enhancing education and training of service providers. The vision. British Columbians are informed about death, grief, and bereavement and how to cope with these life experiences. Additionally, formal support providers, healthcare professionals, and other frontline professionals are equipped with the knowledge and skills that will enable them to deliver high-quality grief and bereavement supports based on accepted standards. Roundtable members propose the following 9 actions. There were 5 action items under grief and bereavement literacy. Ranked first was to enhance basic grief and bereavement literacy for all healthcare professionals. Education is needed for healthcare professionals on how to support and communicate with bereaved people and their families. Training for healthcare professionals should educate them about grief, bereavement, and prolonged grief disorder, teach them how to engage with individuals who are bereaved, and to inform professionals about how to connect their patients to available grief and bereavement supports in their communities. Rank 2nd, enhance grief and bereavement literacy for students, teachers, and counselors in school. Rank 3rd, develop and implement targeted promotional opportunities to introduce grief and bereavement literacy materials to the general public. Ranked 4th was to develop resources and training materials to enhance grief and bereavement literacy in workplaces. And ranked 5th was to create a provincially coordinated marketing and communication strategy for grief and bereavement. There were 4 action items under grief education and training. Ranked number 1 was to collaborate on the development of evidence-informed training opportunities for all support providers. Many organizations have developed different grief and bereavement support training programs for their employees and volunteers based on their own experiences and their unique needs. By bringing together all hospices, community organizations, and others with grief and bereavement expertise and consolidating the various training resources available, a single evidence-informed educational platform could be created. The platform could host several training programs based on criteria like the level of need or the role of the provider, example if it's a volunteer or program facilitator or even counselor. The training programs could be made available to all community organizations and private grief and bereavement support providers throughout British Columbia. Ranked second was to establish standards for grief and bereavement support service delivery. Ranked third, develop standardized competencies for volunteer grief and bereavement support providers. And ranked fourth was to develop a grief and bereavement support ladder framework to outline the different levels of need and identify appropriate supports for each level. Pillar 3, equitable grief and bereavement supports. The vision, all British Columbians receive supports that are tailored to their unique needs and experiences, and respectful of their diverse cultures, beliefs, religions, traditions, and worldviews. Roundtable members proposed the following 7 actions. There's 7 action items under equitable grief and bereavement supports. Ranked first was to enhance available grief and bereavement supports for children. Children experience grief differently and require supports that meet their developmental needs. Ranked second is to offer culturally tailored and non-traditional grief and bereavement supports. And third, embrace cultural humility while supporting Indigenous peoples who are experiencing grief and bereavement. Ranked fourth, enhance grief and bereavement supports for healthcare professionals and frontline workers after the death of a patient or client. Fifth, enhance grief and bereavement training for outreach workers who support individuals experiencing homelessness. 6, create safe space for bereaved people experiencing homelessness to grieve. And 7, hire more Indigenous elders in grief and bereavement support organizations. There is a lot of work that still needs to be done to ensure that all British Columbians have equitable access to effective grief and bereavement supports. Further research studies are still necessary to better understand certain aspects of what is needed to implement an action item. There were many suggested by the stakeholders, as well as research studies to assess the programs, resources, and policies that will be developed. A working group will next need to be created to begin to implement the action items. We are hopeful that this action plan will be a helpful resource to guide improvements in grief and bereavement supports in British Columbia. The task of implementation is too large for any one organization to be able to do alone. It will be by organizations and people working together that we will be able to provide the much needed improvements to grief and bereavement supports in our own communities and throughout the province. The action plan report can be found on our website at www.bc-cpc.ca.